Welcome to the Movement Podcast. This show is all about movement. We tackle it from different angles, bring on guests, answer questions, go on a few tangents, and give practical advice, giving you guys a better idea of how you can optimize the human body to be the best it can be. Let me give you a preview of what's coming up in this episode. On today's episode of the Movement Podcast, we focus on pain and preventing injuries. Gray talks about why he chose his career in physical therapy. We discuss how the Sun Salutation Yoga sequence and the Turkish Get-up can help you maintain good movement in your life. We explore if there is a quick fix for your movement problems, exercising while you have a physical ailment, and some sobering statistics on the health and wellness of our current society. We dive deeper into how we prevent people from getting hurt, the importance of physical awareness, controlling your environment, and risk versus prevention. We close out the episode discussing athletes playing through pain and how stopping and changing direction effectively could be as important as speed. All of this and more on today's Movement Podcast, powered by FMS.
All right, Gray, why did you become a physical therapist?
I recall being very interested in healthcare, but I was also interested in performance stuff. And the healthcare I was most interested in was musculoskeletal. And when I started probing around, like who knows the most about the muscles and joints, I had more feedback from a local physical therapist work here in Danville, a guy named Charlie Smith, Smitty, as a physical therapist who most of the physicians used as a resource for musculoskeletal anatomy. Now, the orthopedic surgeons were good at what they did, but really seeing the problem, seeing who could avoid surgery, who could play through an issue, who could tape an angle, he worked all that out. And I'm like, man, so you mean to tell me this guy's doing everything he does for the musculoskeletal system without drugs? This is sort of, it was a concept to me that using physics, ultrasound and heat and cold and your hands and exercise and torque and stuff like that. And it would immediately sort of engage that mechanical part of my mind. So I'm like, yeah, I would rather be on the mechanic end of healthcare than on the biochemical end of it.
Yeah. So really, you started doing, you got into that, probably sounds like me, 15, 16, just kind of figured out who in our area was doing something and just started following them around, right?
Well, the funny thing was I started patterning myself toward this degree that was coming out, in the in the 80s, a sports medicine degree, thinking that would be more like pre-med or
pre-80s.
Yeah.
Oh, Jesus.
Yeah. 84 high school grad, 88.
So you still get the 84 hairdo?
Well, stick with it, man. It was working then. So anyway, I sort of patterned my high school education and took advanced biology and all that, trying to go toward a sports medicine degree, not realizing it was sort of a cover title for exercise science as much as it was first responder medicine on the sideline and athletic rehabilitation and stuff like that. So it was a very loosely used term, not so much as pre-med or pre-physical therapy as it was to get you sort of to be an athletic trainer or a personal trainer or something like that.
But most of what you're dealing with, much of what you're seeing were people who are already hurt. People who are injured. And what your goal was then was to try to figure out a way to get them back to being more healthy.
And not only that, but part of me felt very, very sad that I was actually dedicating a majority of my day to treating and diagnosing preventable things. It really bothered me that my profession was missing some things. It bothered me that maybe my own education missed some things. It bothered me that I didn't think I was bringing as much good preventative advice to the skill set. I think there was just a lot of bad stuff going on, and I felt like vultures just waiting for bad stuff to happen, seeing it, happen.
And it's no better now. I mean, Gray, you were talking about, the 80s, the early 90s is when you were going and getting your education and, focusing in on musculoskeletal problems, musculoskeletal issues. Well, that's been, Gray, how many years ago was that? Can you do the math? A long time.
I didn't have a bald spot, and you didn't have salt and pepper hair. So
my salt and pepper hair just came in a couple of years ago, starting to work more with you. So, but the thing is, you've been thinking about that prevention, musculoskeletal problems. And right now, today, how we deal with musculoskeletal problems is still after you have a problem. After you have a problem is when you really try to go seek out. So my back hurts, number one problem right now, my back hurts, your shoulder hurts. Well, then you go try to figure out what you can do about it. And it's really, that's not what's going to be the most effective way, is figure out what you can do before you have the problem.
Civil engineers go to the intersections where the most accidents occur and say, we designed this poorly. You don't wait for people to get smarter. You're like, this does not currently serve the population going through this intersection. They're texting more, they're talking on the phone more, so we got to widen everything and have more blinking lights and speed bumps. And I wish it weren't that way, but today's person exercising is about as unaware as somebody driving through a red light texting. They're so disengaged from the activity they know they need to do that it's not going to leave a mark on them anyway.
Yeah. And right now too many people get hurt exercising. Two people start exercising because they're hurt.
Yep.
My back hurts. So what should I do? Well, I'm going to go do some exercises to help my back. Yep. Not having any idea what they're doing, which is, again, should expect them to. That's kind of where we come into play, is to try to help that out. But too often the healthcare is trying to just manage the problem, not prevent the problem.
I've told so many people, you can reference a Sun Salutation from yoga, the most basic 5 or 6 moves that could be assembled or put together as a morning thing. Not a stretch, not an exercise, a habit of syncing your breath and your movement with a few different patterns. If you can't get through 5 of those comfortably, that is your exercise. That's what I'm saying. It's going to be a little bit uncomfortable, but you're going to learn to breathe. That's about all the load, and that's about all the stress you need. And as soon as you can get through it comfortably in the morning, do it again before you go to bed. And before you know it, you'll be ready to exercise. But if you can't get through a Sun Salutation without an obvious asymmetry, tightness, balance problem, flexibility problem, you got your exercise, and it's about 5,000 years old, so it's been vetted. Yeah. And if you need more than that, you're missing the point.
Yeah, but too often the people take what you just said, and that's all they're going to do now. It's just like grip strength. People are just going to say, well, Greg Cook said do Sun Salutations. That'll solve all my problems.
And I'm not winning triathlons. No, you got to train for that shit. But if you can't do a Sun Salutation, that's your first problem.
Yep. I mean, just like there's a study done that if you can get down on the floor and get back up without using your hands, you're going to be much more, have much more longevity. And it's the same thing with grip strength. You have better grip strength. And that doesn't mean everybody start trying to get up and get down, and they're going to live longer. Yep. What that means is that's a good piece of information. But you may not have hip mobility. You may not have the flexibility. So you've got to start somewhere else. And I think that's the misconception. And that's where people get hurt doing exercises that may be working for you as Greg Cook, but may not work for someone at home. So that creates a lot of these injuries that we see.
Yeah, no, it is. I talk to so many parents who hear what a pro sports player is doing and ask me if it's appropriate for their kid. And I'm like, we're not even on the same planet. I can't even answer that question. It's wrong in so many places because, if your kid wants to fly a paper airplane, that's saying, should he eat what a fighter pilot eats for breakfast? It's not even the same thing. And so I see people trying to pull information toward their agenda instead of just accepting things the way they are. Right now, while everybody's locked down, the one thing I can tell you is if you learn to do a Sun Salutation enough to where a yoga instructor would give you thumbs up, even if they had to watch you online go through one, and then once you attain that, if you said, all right, now I'm going to take a kettlebell and learn to do a Turkish Get-up and get somebody who understands a kettlebell to give me the same thumbs up, it's going to take you probably 2 to 6 months, and you will be more put together functionally than you've ever been in your life. And I've used that same type of thing to reset a lot of people who got real myopic in their focus, downhill skiing only. So their quads look like a speed skater and their back is rounded and all that kind of stuff. And so you need to be on that path for a while so it will make you aware of the things that I could never tell you.
Yeah, it's the path. It's if you really want to have an impact in your musculoskeletal health, Because that's really what we all have to think about. When I say musculoskeletal health, it's being more resilient, being more durable. So you can think about what you're going to be like when you're 60, 70, 80, 90 years old. So you're healthy at those ages. And that's what most people are shooting for or really hoping for. But they're looking at what can I do now in order to get there? And there's no magic bullet.
No, and I can tell you right now, there's a lot of people that heard me say Sun Salutation and progress to a Turkish Get-up who think I just gave them a rehab program. If you have pain in any of these movements, meaning it hurts worse when you keep doing it, you are bringing a fitness solution to a healthcare problem. So I did not say these things will rehabilitate you, even though once you get rid of your problems, they will maintain you as good as anything on the planet, and they've been around for a long time. But there are still some people who are hurting and who will continue to resist seeing a professional because they might not want to hear they got arthritis, or they might not want to hear they tore that muscle, or they need a surgery. And so, the ostrich with its head in the sand doesn't look too smart.
Yeah, and it doesn't mean just because you have an ailment that you can't be active or do exercise. It's a matter of where are the guardrails, what are the guidelines in which I can exercise? Because we get this question all the time. I've got arthritis in my knee, and the doctor told me I shouldn't be exercising. Well, no, the doctor probably doesn't want you to do certain exercises that are going to inflame the knee, but that doesn't mean you can't do certain exercises.
Because if he sends you to physical therapy, guess what's going to happen? You're getting exercise. But what he's saying is, on your own, I don't trust you. You're the one that made your knee this bad so far. So if they tell you not to exercise and don't recommend another professional path, then they're waiting until you can't tolerate the pain until you get surgery. And I don't think that's real responsible, because there's a lot of ways we could get you moving without surgery. But, the best orthopedic surgeons I've ever worked with have been through physical therapy. And the best physical therapists I've ever worked with have faced exactly what their patients do with a surgery and rehabilitation. And it's a whole different perspective. And the people who've never been through physical therapy don't have a strong referral for that and wonder why their outcomes aren't as good.
Right. It's about getting properly diagnosed to make sure you know what the problem is, but also then getting properly diagnosed so you understand where the underlying problem is. Because just because it's your back, and then you go on the internet and you read something that says this is the best low back exercise, well, it may not be a low back problem. And that's a big misconception that I think people want to try to sell you. That's going to try to sell you that magic bullet is saying this is the best exercise. Well, your back problem may be a symptom of an issue that could be in your ankle.
Exactly. And things have gotten pretty complex. And I think a sign of the times is there is no society that's ever existed on the planet that could have a population moving this poorly and still be called a civilization, because there wouldn't be enough people fit enough to feed you, to build buildings and stuff like that. So we're a very unfit and dysfunctional society, but we've got a very soft environment. Everything's flat, everything has rails, everything's paved, and it's all going to be okay. And when things get a little harsh, you see a lot of people who thought they were more fit than they are. 81% of the United States, according to a Gallup poll, thinks they're in good to excellent health. And 60% of those same people have at least one chronic disease, and 40% have two or more. 50% have orthopedic issues called pain or some dysfunction or disability coming from that. So the illusion is, as long as I'm healthier than the guy with the oxygen bottle in the mall, I'm healthy. And that's not a good baseline.
All right, let's take a quick break. And when we come back, we'll go a little bit deeper for the professionals out there.
Pain changes movement. The SFMA is a structured, repeatable, movement-based diagnostic system that healthcare professionals use with patients experiencing pain. The SFMA is built around 7 fundamental movement patterns and integrates a concept known as regional interdependence, how seemingly unrelated problems are actually driving the dysfunction and causing pain. By understanding which patterns to assess further, the clinician develops a differential diagnosis, identifying mobility versus motor control dysfunctions, which allows them to create a more efficient treatment plan. The SFMA is the first system to include diagnosis of motor control dysfunction and provide a systematic approach to reteach the brain proper movement using the neurodevelopmental perspective. Using the SFMA logic, clinicians know exactly where to target their treatments and can easily retest for effectiveness of treatment to return a patient to their activities. Get started today and find a course near you.
So the big question everybody asks, like one of the biggest questions we get asked, Ray, is about injury prevention. How in the world do we prevent people from getting hurt? And right now, most people assume we want to talk about athletes. And the bigger problem is most general population people. I don't want to say most. I mean, we can get the stats, but there are a lot of people out there walking around with pain in their backs and their knees and all those sorts of things. Well, technically that's an injury. And those people are the ones we have to be thinking about just as much as everybody else. But if you really look at it, Gray, they're already injured.
No, and I'll reframe that because I think that's one of the most compelling things I ever heard you say to a group of athletic trainers.
That's one of the most compelling things?
Yeah.
You haven't been listening.
No, it is. Everything else is pretty much just rephrasing what I just said. So
somebody's got to. Somebody has to.
I want you on that
somebody
wall.
Has
I need
to put
you
on
that
put
wall.
it on a spoon instead of fire hose.
It's greatly appreciated. The guy at the UN wants the translator. I mean, but no, you were talking to these guys, and it's like, two fleas arguing over who owns a dog. They were debating the score in the FMS, not realizing that at high school physical, we got about a 20% fail rate due to pain of kids who are going to be in these same positions with other kids on top of them or running at full speed or cutting on a dime. And the fact that these kids pass a medical physical and then flunk a movement screen due to pain, regardless of what their score is, tells us that people have lost their physical awareness and they don't know how to self-gauge against physical obstacles. The turf's not always wet and the shoes are not always to blame. You don't know how to stop. And even though you got lucky the first 3 times, 10% fatigue, kaboom, and you didn't see it coming. And that's where I think the problem comes. So if we're going to confront this problem, it starts with awareness. And if you don't set baselines, then you're just telling people they're not aware, and that don't work. You got to show them they're not aware. And we use physical tests and functional tests for that. And people who are still in denial are probably going to do too little or too much. And what I think we find is too many people try to relate your injury risk just to a movement screen or a YBT or a survey instead of saying, how aware were you that you were going to score this way? Because the people who think they can and don't are probably going to put themselves at risk. And the people who think they can't but can are probably not going to stress themselves to get any better. So,
I think, but one thing you just said right there that needs to really, with all of our years of teaching and being educators, that we still struggle with getting people to appreciate is that word risk. Risk and prevention are not the same thing. And I think we're all searching for how we can improve someone's risk of having something, whether it's an injury, whether it's back pain, whether it's their diet and obesity and just living a healthier life. We all have to identify the first order of business. And you said it, making people aware. Well, they need to know what we're looking for. We need to make them aware that what you're looking for is not necessarily what you think it is.
No, if you're involved in making yourself physically better, you're going to have accidents. Airbags don't prevent accidents. They prevent accidents from causing death or greater physical problem. And so you're going to bounce off the world. You're going to bounce off other people. You're going to bounce around the tennis court, or you're going to stripe a golf ball. You're going to have accidents. And that's part of physical development and physical management and refinement. But then realizing where your lane is and how to stay there without somebody constantly having to tell you is self-management and self-regulation. And so you can have a lot of mobility and stability issues and be an amazing athlete. And geez, Lee, you've measured some of the athletes that will go in the Hall of Fame for all time. Their movement screens weren't impressive, but their physical awareness, their skill, and their the way they related to their obstacles were totally efficient, totally effective, and didn't lay them out there at risk. But even then, we know what was behind the scenes. They still had to have a lot of maintenance work. So, when you've got a movement screen that causes pain, that's a completely different category than a movement screen that's not favorable and one you're aware of.
Well, that's the thing. I think we've spent our entire career of trying to somewhat explain this whole idea that a concept that you had going on probably 25, 30 years ago. And the whole concept is we've always tried to reduce injuries for individuals. That's as sports medicine professionals, that's what we do. Reduce someone's risk for injury. We're all trying to do that, right? You want to make somebody more healthy and they smoke? Well, the best thing you can do for them is to tell them to quit smoking. And I think with us and what we've been trying to convey all these years is, yes, we're in the business to reduce the risk for injury. We want to prevent injuries. So in order for us to prevent injuries, we have to, before the injury occurs, which is the first mistake people make, if they're already in pain, they're already hurt. And you just talked about the movement screen. And when we look at the movement screen, in how we evaluate movement and ever how you assess someone's movement, if the person has pain with those movements, they're already at risk. I would argue they're already injured. And that's the first thing, the real reason the movement screen was conjured up from you is to say, hey, this person, can they go through these different movements without pain? The second part of that is, if they can't, well, one, we need to fix the problem, but we certainly don't want to put them into higher level risky situations. And again, doesn't mean they can't play their sport, but it does mean I can alter what I do as their medical professional and their strength conditioning professional. And that's where people overlook and miss that whole concept of let's identify them and let's remove them from certain situations.
Protect before you correct before you develop. And if we can't remove the negative first. So when you have that person that's in pain in a what should otherwise be a normal movement pattern, you're sitting there at a crossroads. And the number one thing is what's causing this pain. And secondly, if I let them get up against this pain or do anything in this pattern, something's going to happen. And it's called reflexive behavior. That means you can't outthink compensation that's caused by pain. And we know that pain distorts your motor control in an inconsistent and unpredictable manner. That's not a good learning environment. So exercising in a painful pattern or in patterns that accumulate and create pain are actually washing off the blackboard every time you put up a new equation. So if you're trying to motor learn in the presence of pain, good luck.
Well, and that's the thing is too often people make assumptions that when we say, hey, this person shouldn't do this in pain. Again, if I've got an athlete, and I've done this probably too often, I'd like to admit, person may have some pain, but he's going to go play that weekend. He's going to go play Friday night or Saturday or Sunday. Again, they do it. We're athletes. I can throw some tape on their ankle. I can put a knee brace on them, and yet they're going to go out there and they're going to probably be in some pain. However, that's not an environment I can control or anyone can control. That's why we can't prevent an athlete from getting injured. But the environment I can control is when they're not on the field, is when they're not playing the game, when they are in the training room or in the weight room. That's where we have to take what you just described and avoid the compensations. I know if I tape somebody's ankle up, they're going to compensate, but that's okay for that period of time, for that environment. But the environment we have to control better as professionals is when they're either in in the weight room or the training room, or even giving them advice when they're not.
I've used the movement screen to help me speak the truth in those very situations because I'm going to ask you a question.
Speak the truth.
Yes, sir. I'm going to ask you a question about your physical health and your movement function. And I'm going to let you answer it with your mouth. And now I'm going to ask you the question, and I'm going to let you answer it with your body. And if they're not the same, we got a problem. One of the reasons I've always loved working with a team that's got a preseason baseline on the movement screen is when they get injured and we're rehabbing them back and they think it's go time, and maybe a mom or dad thinks it's a go time or a coach thinks it's a go time, I simply come at it like an accountant. They had an 18 on the movement screen. They're currently pushing a 13, and I know they're working hard to get it. This is not the same athlete that was pre-injury. Their agility, their endurance, their explosion is not going to be the same. If you got somebody playing behind them that can outrun them in a 40 right now, play them, because it's about pride right now, not about the team. So I can quickly say that I know you want to go back in the game, and I admire the fact that you do. Statistically, not only are you putting yourself at unnecessary risk, you're not doing the team any favors at all, because they're used to you having a certain movement pattern that will not look the same now. So you're going to throw off everybody that you're working with. So But if you've covered that movement screen, so that's how I used to make the movement screen part of the discharge criteria. You will feel better long before you will show me that you're back to your old self. And that's because I think as therapists, as athletic trainers, chiropractors, whatever, we don't remove the risk factors. We know we should because insurance hasn't offered to pay us for that yet, but somebody's got to move first. Somebody's got to move first.
Well, and part of what you just described is you got to have that initial baseline. You got to have something to bounce it off of. And one thing you just described there, when somebody does sustain an injury, which we know they will, if you are trying to increase your activity level, if you keep pushing yourself, you may push yourself too far. That's okay. It just, it's life. But how you respond to that injury is directly dependent upon how you went into that injury. Meaning, we've got data that says if you had a good movement screen going into the injury, you're going to be back to return to play quicker than someone who had the same injury, had poor movements going into that injury. And I think it's how you go into that injury, whether it's your lifestyle, whether it's your movements, whether it's your activity level, you're going to probably come out of that injury a little bit quicker and a little bit just as probably better off.
Yeah. No, if you look at the injuries we've had, the ACL epidemic, young athletes with low back pain, I first saw this when I started working in high level tennis. We were showing kids speed and power drills at about 80%. And showing them deceleration and direction change to about 20%. And I said, oh my goodness, we're creating this situation. The majority of musculoskeletal injuries occur at deceleration and direction change. And that's the one thing they're overlooking because everybody's impressed by speed, but the illusion of quickness on the basketball or tennis court is the person stopping quicker, under control, and changing direction while somebody else hasn't made up their mind yet. And so the illusion of quickness isn't power at all. It's that deceleration, direction change, and management of your momentum. And nobody trains that. And if you're not functional, you can't even get low. So there's kids that need to get low and aren't using that, and there are kids that can't follow the instruction, and that's the difference between fitness and function.
Awesome, guys. All right, let's wrap up this episode with a few questions. We heard about how Gray went into physical therapy, but what influences in your childhood may have inspired you to go into your career?
Yeah, I think I was always active. It was never a question about, that wasn't even a thought. But I think the biggest thing that changed my perspective was I got injured. I broke my leg when I was, broke my femur, and of course, Gray makes fun of it, when I was like 7 or 8 years old. And, I experienced healthcare at that young age, and it made a lasting impact. I had an orthopedic surgeon, Dr. Ogden, who was the guy back then. And just the interaction I had with him, how he treated me, going through that injury is what sparked my interest from that point. So that was a very young age. And then just, again, being active, playing sports, doing the things that we do. I just kept that interest up. And then going into school, when I was looking at different universities and colleges I wanted to go to, I'd noticed the things that sports medicine, athletic training, and I was like, perfect. There you go.
The movement, the Turkish Get-up, was brought up in that segment. Can you explain and give a little bit more detail about the Turkish Get-up?
First of all, Strong First with Pavel and Brett Jones has done a great job, I think, preserving the integrity of kettlebell moves like the swing, the get up, and the snatch, and all of the other moves that we see a lot of different variations of, but those variations have a lot more to do with people just trying to create variety than trying to create integrity. So going to the sources that I went to when I first started looking at the Turkish Get-up, or some of the publications that Pavel had something to do with, and Brett Jones had taught me going through the RKC training and stuff like that. But you will see a lot of variations, but I honestly think that most people who try Turkish Get-up try it loaded first. And if you can't even get through it with body weight, and Brett Jones and I used to use an example of placing your shoe on your fist and holding that fist level, and halfway up people would say, why aren't we doing this with a kettlebell? And about that time the shoe would drop and bonk them on the head, and I'm like, because that could have been a kettlebell. And it was just basically saying, why are you worried about load when you don't have integrity? And so it's always been a great example. And the history of the Turkish Get-up coming from flat on your back to standing with an already pressed out kettlebell is the move you're doing. And you have to go through almost every movement pattern that the movement screen vets, meaning those people who get really high movement screens can learn the Turkish Get-up very, very quickly easily because it's literally transitioning from a few different postures. And as soon as you know them, you can come straight up and straight down. And it's much easier than it is for somebody who has mobility or stability problems. They smoke check simply because they don't know how to find alignment in 5 or 6 different postures. And if they can do it on one side, they're not nearly as good on the other. And so Brett and I started doing a lot of history on the Turkish Get-up and realized that it was something that strength cultures did, not necessarily as a training module, but to say, if you can't do this, we won't train with you. Meaning good strength development starts on a base of owning your posture, your mobility, your stability, your integrity. And I've always said the Turkish Get-up is more of a carry than a lift because the bell is already pressed and you stand up under it, which is a carry just like holding it and walking somewhere.
That'll do it for this episode of the Movement Podcast. Thanks for listening. And if you liked what you heard, please subscribe and share it with your friends and family. If you want to learn more about our system and take the next step in your movement journey, visit us at functionalmovement.com. Until next time, be sure to move well, move often.